It's that time of year again, just a few weeks from Halloween, and it's always good to get some reminders on safety when it comes to the big day. This year, there's another possible treat to watch out for, so Bridget is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
That's right. We are talking about rainbow fentanyl, a deadly drug that looks like candy. You may have heard about it already. It's been making headlines saying drug dealers are targeting kids with bright colors. Experts say, though, the colored pills on the streets are nothing new and not about targeting children. However, it's a good thing to be aware of in the event you or your child come across it. So joining me this morning, Dr. Jenna Wheeler, a pediatric critical care physician at Orlando Health Arnold Palmer Children's Hospital. Thank you for coming in, Dr. Wheeler.
Thanks so much for having me.
So the rainbow fentanyl, I mean, it is scary. The experts are saying it's not targeting children, but right now, you know, this is a candy time of year. What should we be aware of among our family members and children when it comes to that risk?
I think for years we've always talked about how you should check your children's candy for evidence of tampering to make sure that it's safe, even from a choking hazard. But I think this year in particular, knowing that there are candy that's out there that's targeting children that's actually containing very dangerous drugs, we really need to be vigilant in looking at all of the candy, and also with our older kids of educating them on this so that as they're eating the candy, maybe not with parental supervision, that they're knowing what to look for as well.
What are some of those best practices when it comes to, you know, deciding how to do the trick-or-treating and looking over the candy, rationing out the candy, and things to keep in mind for safety, you know, on the night of, as well as moving forward with all those bags of candy?
I think it's good to always look at the candy and always to kind of keep an eye on how much candy your child is having. You know, kind of set a point where you want kids to be out there having fun, enjoying themselves, but eating a good healthy dinner before you go out, knowing that along the way it's okay to have some pieces and then put the other pieces away. Especially if your children have medical problems like diabetes and such, have a plan within your family. Ask doctors if that can help you in knowing how much candy your child can safely have. And then if you have older teens or kids that are trick-or-treating by themselves, know the route that they're taking, know where they're going to be, have them check in along the way, a set time for being home at night, and being Florida and the temperatures being what they are, always make sure your kids have water throughout the night.
Okay, that's good advice as well. And you talked about the older children and making sure they have a plan. Is that something that comes up a lot in terms of, you know, kids maybe ending up in places where they maybe shouldn't be on the night and it being more dangerous?
I think it's good to just know what doors your child is knocking on. You know, we don't know all the people. It's a night when you go to a stranger's home when other nights you wouldn't. And so knowing the route that they're along, having those check-in points, I think it's a really good practice. I mean, we always want to know where our kids are, but this night we give them a little bit more leeway. And so having a set path that they don't deviate from and knowing whose house they're going to be at. And in this day of, you know, phones and texting and such, it's really easy to stay in touch with your child in that event, and it's important to do so.
Mm-hmm. And what are some of the, like, maybe healthier ideas if, you know, you haven't done all your shopping yet or planning yet for those get-togethers and parties? Do you have suggestions to kind of help people curb some of the, you know, unhealthy choices?
It's all about balance. And so, you know, setting kind of ground rules with the family, or, you know, if you have a really healthy dinner or a healthy snack, then you can have X number of pieces of candy. Using candy as a reward for things and kind of just balancing that is the best way.
Yeah. And what about the bulk of the candy? Because we talked about rationing it out. Sometimes that means you have to hide the rest.
And that's an important point, and that's where it kind of comes to just taking some responsibility for that, letting the kids have fun, taking some pieces yourself, of course, and then putting it up and having kind of a plan that it shouldn't all be gone in the first week. But it's something that, you know, kids can come home, do homework, and enjoy some candy, or have a nice snack and enjoy a few pieces of candy.
Mm-hmm. Maybe create some rewards
along
the way to get access to more of the candy. And again, when it comes to the fentanyl and things like that possibly contaminating, what should we keep in mind again?
Keep in mind that there are drugs out there that look just like candy. And so it's so important. We saw the colors on the screen. It's so important to really look at the candy, look at the labeling, because sometimes the packages, it's very subtle in the differences, but they are named slightly different things. And so just be aware of what your kids have. And like I said, educate the kids as well, that if they have any concerns, they bring that candy to you so that you can check on it.
All right, great. Everyone keep some eyes on that candy this holiday season. All right, Dr. Wheeler, thank you so much.
Thank you.